Hey everybody, Sean Keating here. I want to welcome you to the Dental Up podcast show by Keating Dental Art. This week we have Dr. Richard Carrara DMD from Morristown, New Jersey to discuss how he has been committed to dental care for almost 3 decades. Today we'll be talking about how 2 friends from dental school became partners with the same vision and ideals in terms of quality and how to run a dental practice. Dr. Carrara will be discussing how technology has changed in the dental industry and how he's planning on implementing these changes to his practice. This guy I've known for a long time, and Dr. Carrara, good to have you on board.
Thank you, Sean. Yeah, it has been a long time. I was thinking this morning when you asked me to do this, I think I've known you only about 6 years longer than I've known my wife.
I know, man. It's like 1990 or 91 we started working together, and I just can't thank you enough for all the work, dude. And you do so much good work, and you're one of my New Jersey doctors, man. In Morristown, I don't know where the Morristown is. Is that by MetLife Stadium at all, or are you guys by the Jersey Shore? Where the heck you at in Morristown? We're
in like central northern New Jersey, so we're probably about 40 minutes outside of New York City.
I always remember a big Sopranos fan, and the way New Jersey there, it looked like it was like in the hills and a bunch of trees and just real kind of beautiful. Is that a fake area of the Sopranos, or was that real in New Jersey actually?
No, that's actually real. I probably grew up only about 2 or 3 miles from that house, actually, that they filmed in.
No kidding. Yeah, I remember too that you got that strip club there, Bada Bing or something, or
I wouldn't know.
Yeah, no. Yeah, that's the right thing to say, because our wives will probably listen to this later. I've never been I've been married 33 years or whatever. It's been 34 years, I tell her, since the last time I've been in one of those. No, that's funny.
So but it is a beautiful state, nice state to live in and to practice in.
No kidding. Let's dental up. What college did you go to dental school?
Went to University of Medicine Dentistry of New Jersey. Okay. Went to Drew University as an undergrad. Then I did a master's at Montclair State University, and then went to University of Medicine and Dentistry of New Jersey, which is down in Newark, part of Rutgers. So now I'm a Rutgers grad. Great clinical experience there. My partner and I both graduated from that school.
Yeah, Dr. Carcello is your partner, and tell me a little bit on your practice. Where you wanted to set it up. Is it your first practice, second practice? Have you been in the same place? Tell us how you started, and maybe like out of getting out of dental school, I'm not sure how much debt you had. Tell us starting off, how was it? And if you're, tell us a little bit about that.
Well, I got out of dental school. My partner was a very good friend of mine in dental school, and my partner did a general practice residency when we first graduated. I was getting married about 2 months after we graduated, and my plans were a little different. I needed more. I needed the money, so I skipped the general practice residency, went into private practice with another doctor. As an associate, which was a quality practice, and was a good decision for me because he allowed me to do, and I think some young guys get into practices and they're kind of hogtied. Maybe the doctor that brings them in is reluctant to let them do and treat whatever they would like to do. And this particular doctor allowed me kind of free rein and almost took me in as a partner. That kind of a feeling, and it was a good experience. I was there only for about a year. My partner and I then purchased a very small practice in Morristown that was a young doctor who had just started growing the practice. His wife got transferred down south. We took over the practice. We were in a second floor walk up, small practice, not many patients, but we decided to go into it with both feet. We didn't work separate practice. We worked our practice 5 days a week. And that's just, we felt we would grow the practice that way rather than, I know a lot of people start out, working a practice maybe 2 or 3 days a week because they're just not as many patients. And we felt, let's just hit this hard and grow the practice from there. And, 28 years later, here we are. We always have had the mindset that we were going to be quality oriented. We started out, even back then, not joining many insurance programs, certainly not getting into any DMOs because we just didn't believe in the model.